11th Survival Guide Podcast Friday 5, our weekly recap of 5 things you should know about. I'm your host, Sarah Rueppel, and today is Friday, March 20th. It is officially the first day of spring, so join me as we wave goodbye to winter and say hello to warmer temperatures, budding trees, and believe it or not, I've seen the first little shoots of both daffodils and tulips. And as we are waiting on the first actual blooms of spring, we also happen to be waiting on the 2027 Medicare Advantage and Part D final rule. CMS has promised that to us by Monday, April 6th. Last year, that dropped on Good Friday right before Easter. Hard to imagine that we'll get it sooner this year, but you never know. And as I've been keeping an eye out for that, I've come across quite a few interesting reads online that I thought I'd share here at number 5 this week. The first of which, the Medicare Payment Advisory Commission's March report to Congress. This MedPAC report has been cited in quite a few different places this week, so I thought I would link to it here just in case you're looking for some light reading. And fair warning, it does weigh in at almost 700 pages. And then there's another report from the Joint Economic Committee entitled The Part B Premium Pass-Through. That is also a worthwhile read if you're into that sort of thing. And it's a much lighter read at just 28 pages for the JEC brief. Both of those documents, I would say more than MedPAC 1, have been at the source of a lot of discourse over Medicare Advantage right now. I think it's worth reading over it and understanding what's going on at the legislative level. Some very interesting arguments being made in there, and like I said, quite a bit of discourse on social media around those reports. And while we're on the subject of social media, I have been geeking out more than a little over Gary Vee's not-so-recent declaration that social media is dead, and we're now living in the era of interest media. I am currently digging into that. It might end up being its own episode. I might be looking for someone to come on and talk about it with me because, as usual, I have questions. If you think that person should be you, please reach out. asgpodcast@ritterim.com. I would love to chat. Moving on to number 4, we've got some news from Audible. Earlier this month, Audible debuted a new subscription level while sunsetting an old one for new subscribers. Audible Standard is the name of the new subscription tier. It includes 1 audiobook credit per month, as well as access to podcasts on Audible. Users get a 30-day free trial, and the cost is $8.99 per month. That tier looks to have replaced the Audible Plus subscription level, at least for new subscribers. If you currently subscribe to Audible Plus and you don't make any changes, you will be able to keep your plan. That tier is priced at $7.95 per month. It does not include monthly audiobook credits or access to podcasts, but it does include access to the Plus catalog. Audible has 2 other subscription tiers, Audible Premium Plus, which includes a monthly audiobook credit, access to podcasts and the Plus catalog, as well as a 30-day free trial. And then if you tend to burn through your audiobooks rather quickly, there's an Audible Premium Plus 1 extra credit level that gives you access to 2 monthly credits, Audible podcasts, and the Plus catalog for a price of $22.95 per month. Exclusive discounts are available for both levels of Audible Premium Plus. Now, I've considered subscribing to Audible in the past, especially if I find an audiobook I would like to start and have already maxed out my listening hours on Spotify. But if I run out mid-book, Audible would not be very helpful, even though the standard tier is less expensive than a 10-hour top-up on Spotify. Usually, I either pause until my hours reset at the beginning of the month, or I scramble to either find the audiobook or the regular book from my local library through Libby. I have done that many times. So if you're thinking about dropping down to the standard subscription tier from the Premium Plus level, there are two important differences I would be aware of. The first, Premium Plus members get to keep their audiobooks even if they cancel their membership, while standard plan members only get to keep their audiobooks as long as they maintain their membership. Another important difference, premium audiobook credits roll over from month to month, only expiring 12 months after issue. Standard membership audiobook credits are use it or lose it. They do not roll over. We will have links to learn more about Audible in our episode notes. Coming in at number 3, and a super short mention here. Last week, Universal Health Services announced plans to acquire the virtual behavioral healthcare company Talkspace. The deal has a valuation of about $835 million and will bring almost 6,000 licensed professionals into UHS. Universal Health Services and its subsidiary companies currently run over 500 facilities, ranging from both inpatient and outpatient behavioral health facilities to acute care, urgent care, and freestanding emergency rooms. In the press release announcing the acquisition, UHS mentions the growing demand for behavioral health care. According to UHS Chief Financial Officer Steve Filton, the company has been prioritizing growth in their outpatient services. He mentioned that the plans to acquire Talkspace will encourage outpatient growth while also helping patients who need more intensive treatment flow seamlessly into UHS facilities. He said, quote, "By acquiring Talkspace, we're acquiring their cadre of 6,000 therapists, many of whom Talkspace believes have additional capacity as more demand is created. And we believe this acquisition will create more demand," end quote. The deal is expected to close in Q3 of this year. Number 2. Last week, we published an episode covering the second cycle of Medicare drug price negotiation, with pricing planned on taking effect for coverage year 2027. Back in January, CMS announced the list of drugs they selected for the third cycle of the program. Last Friday, CMS announced that all manufacturers have agreed to participate in the program. For coverage year 2028, the program will expand to include 15 negotiated drugs payable under Medicare. This third cycle marks 2 firsts for the program, the addition of 5 Medicare Part B drugs to the list, as well as the first renegotiated drug. We'll start out our list with info about the latter. Tradjenta from Boehringer Ingelheim Pharmaceuticals was selected for renegotiation for the 2028 cycle of the program. Now, per CMS program rules, renegotiation can occur for several different reasons, and we'll be linking to their PDF that answers a few frequently asked questions on the subject. But as far as Tradjenta goes, it's on the list for renegotiation because it came out in 2011, and come coverage year 2027, there will still be no generic version of Tradjenta. When a drug hits the 16-year threshold with no generic version on the market, CMS considers it to be a long monopoly drug. That change in status enables CMS to renegotiate pricing since their original negotiation, which just happens to have taken place the year prior. In 2024, 274,000 Medicare beneficiaries used Tradjenta to treat their type 2 diabetes. CMS didn't offer updated stats on Tradjenta in the 2028 announcement, but as far as all the other drugs on the list, CMS used enrollment data from November 2024 through October 2025. Also, new for 2028, CMS was able to include Part B drugs in their list of selected drugs for negotiation. Part B drugs are typically administered by a doctor in a clinical setting, and 5 of them made the list for 2028. First on our list, Orencia from Bristol Myers Squibb, which is used to treat psoriatic arthritis and rheumatoid arthritis. 72,000 Medicare enrollees used the drug for a total cost of almost $2.5 billion. Next up, from Takeda Pharmaceuticals, Entyvio. 37,000 Medicare beneficiaries used the drug to treat Crohn's disease and ulcerative colitis. Entyvio represents almost $1.5 billion in Medicare Part B and D spending. Botox and Botox Cosmetic from AbbVie. This Part B drug is used for chronic migraine, overactive bladder, spasticity, and other movement disorders by 390,000 Medicare beneficiaries. Spending on Botox came in at just over $1.1 billion for Medicare Part B and D from November 2024 through October 2025. Xolair from Genentech and Novartis is next on our list of Part B drugs. 40,000 Medicare beneficiaries used the drug to treat asthma and chronic spontaneous urticaria. Spending on Xolair came in at just over $1 billion. And the last Part B drug on the list for 2028, Cimzia by UCB Incorporated. Cimzia is used by 38,000 Medicare beneficiaries to treat Crohn's disease, plaque psoriasis, psoriatic arthritis, and rheumatoid arthritis at a cost of almost $800 million per year. Now for the Part D drugs on the list. We will start out with the Eli Lilly drug, Trulicity. Used to treat type 2 diabetes alone, type 2 diabetes and cardiovascular disease, or multiple cardiovascular risk factors. Trulicity is used by over 600,000 Medicare beneficiaries to the tune of almost $5 billion. Next up, Biktarvy by Gilead Sciences. 101,000 Medicare beneficiaries use Biktarvy to treat human immunodeficiency virus type 1 infection at a cost of almost $4 billion. Cosentyx by Novartis is next on our list, another drug used to treat plaque psoriasis and psoriatic arthritis. 40,000 Medicare beneficiaries take the drug at a cost of just over $2.3 billion. The prostate cancer drug Erleada by Janssen is next on the list. 19,000 Medicare beneficiaries used this drug for treatment of cancer at a cost of almost $2 billion. Breast cancer drug Kisqali by Novartis also made the list. 17,000 Medicare beneficiaries used the drug between November 2024 and October 2025 at a cost of almost $1.6 billion. Verzenio by Eli Lilly is another drug used to treat breast cancer. 15,000 Medicare beneficiaries used the drug at a cost of just over $1.4 billion. Eisai and Merck's Lenvima was next on the list, a Part D drug prescribed to treat thyroid cancer, endometrial cancer, liver cancer, and kidney cancer. 10,000 Medicare beneficiaries spent just over $1 billion for Lenvima. Next up, Rexulti by Otsuka Pharmaceutical. 119,000 Medicare beneficiaries are prescribed the drug for treatment of major depressive disorder, schizophrenia, and agitation associated with dementia due to Alzheimer's disease. The cost of Rexulti came in at just over $1 billion in spending for Medicare beneficiaries between November 2024 and October 2025. Xeljanz and Xeljanz XR from Pfizer are the penultimate drug on our list. 22,000 Medicare beneficiaries paid just over $1 billion to use either form of Xeljanz to treat their psoriatic arthritis, rheumatoid arthritis, and ulcerative colitis. And then last but not least, rounding out our list is Anora ellipta from GlaxoSmithKline, which is used to treat chronic obstructive pulmonary disease, or COPD for short. 281,000 Medicare beneficiaries use the drug at a cost of just over $800 million. We will be linking to the press release and the fact sheet from CMS on the third cycle of this program in our episode notes. Highly recommend checking out the fact sheet to learn more about the program in general. And we will also have links to our coverage of the program here on the podcast, as well as the Ritter blog linked in the notes for you. And moving on to our number one story this week, let's talk Microsoft, which I know, strange, because I am usually very Apple-oriented on this podcast. Last week, Microsoft announced a new side to their AI Copilot. They're calling it Copilot Health. It's currently invite only, and most importantly, as far as data privacy goes, it exists in its own separate and secure space. Microsoft describes it this way, quote, Copilot Health brings together your health records, wearable data, and health history into one place, then applies intelligence to turn them into a coherent story, end quote. They go on to mention how combining these previously disconnected data points will hopefully give users not just a better picture of their health, but more information that will then turn into improved conversations with medical providers, and also maybe stop us from doom scrolling symptoms and self-diagnosing. Initial partnerships include HealthX for health records, Function for lab test results, and Apple Health, Fitbit, Aura, and other wearable devices for vitals, sleep patterns, activity levels, and other data. Copilot Health, as I mentioned, runs in a separate and secure space that differs from other Copilot models. To inform this instance, Microsoft brought together a global team of clinicians who worked to create Copilot Health, adding their, quote, medical expertise, safety feedback, and real-world perspective, end quote. So the model has been trained by real-world clinical professionals, and Microsoft makes it clear that user data will not be used for model training. Copilot Health includes additional security and encryption compared to the public version of Copilot. And another interesting mention, something called ISO/IEC 42001 certification, which the release mentions as, quote, the world's first standard for AI management systems, end quote. Very interesting product, and to be honest, as part of a demographic cohort with increased rates of certain types of cancer, if this is a way to connect some of those dots sooner, leading to an earlier diagnosis that increases potential for survival, that is pretty incredible. And one other note here, if this reminds you of Lufu, the AI created by the founders of Fitbit, I was thinking the same thing initially until I compared the two a little more deeply. Both bring health information into one place, allowing for better organization. But where Lufu was designed more for proactivity and ease of use, Copilot Health takes it a step further. It allows users to sift through the information, acting more like a concierge as it can answer questions and bring information back to the user. More specialized, usually more conversational, and also personal to the user because of the additional data you give it. Microsoft is taking it super slow with the rollout. As I mentioned earlier, there is currently a waitlist to join. Very interested to hear more about Copilot Health and how it evolves as it opens up to more people. But that's all we've got for this week's show. Just a reminder to check out the episode notes for links to what we talked about here in today's episode. Also there, the link to reach out to us here at the podcast by email, asgpodcast@ritterim.com. Send in your questions, send in your requests to be a guest here on the show, or send in a shout out you want read here on the Friday Five. If you're celebrating a birthday, maybe an anniversary, you just opened your own agency, or you just wrote your first policy, let us know. We would love to give you a shout out here on the show. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Rueppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.